Hello everyone. In this video we'll learn about anxiety. Have you ever woken up after drinking and felt not just a headache but uneasy, nervous or worried for no clear reason? This feeling has a name, anxiety. That's a blend of hangover and anxiety. This is Rima Stanley, Associate Professor, Triple M College of Nursing. The objectives is to learn what is anxiety, common emotional symptoms, common physical symptoms, and how alcohol affects the brain, and also ways to prevent anxiety. Now, let us see what is anxiety. Anxiety is the anxiety or emotional distress that can follow a night of drinking in addition to a typical hangover. Now, why it is called that way? So, the word combines hangover plus anxiety because it reflects not just physical discomfort but mental unease. So, there are several factors that contribute to hand anxiety, such as rebound anxiety, which is a temporary but intense return of or worsening of anxiety symptoms, such as like jitterness, etc. Then dehydration is also one of the reason that contributes to anxiety. Low blood sugar, alcohol withdrawal, guilt and shame, and the kind of stress management that a person would engage himself. Now, let us see some of the common symptoms of anxiety. So, after drinking, people may experience actually emotional or mental symptoms and physical symptoms. So, the first, let's see the emotional or the mental symptoms, which includes anxiety, dread, nervousness, worry about what they did while drinking, restlessness, or panic. And sometimes the person may also experience shame or regret about last night's behavior. So, those are the emotional or mental symptoms. While the common physical symptoms, which is linked to hangover and anxiety, are such as increased heart rate, fatigue, poor sleep, headache or nausea, dehydration, and low mood. So, hangover symptoms, including anxiety, tend to be most severe the day after drinking when the body's blood alcohol level returns to zero. So, they can last for about 24 hours, sometimes longer, depending on how much the person had to drink and the other physical factors such as the body size of the person and the liver health of the person also would contribute on the kind of symptoms that the person would be experiencing. Now let us see how does a hang anxiety occurs. So this can be explained by brain chemistry changes that happens. So alcohol basically increases GABA, that is a calming neurotransmitter, which increases during drinking. So when alcohol leaves the system, GABA drops and glutamate, that is a stimulating neurotransmitters, that can spike, so which results in anxiety. Also we can explain via neurochemical rebound theory, which tells that it's a feel good chemical like dopamine and endorphins, which spikes when alcohol and then quickly falls, which makes the person feel anxious, feel stronger than the next day. Then the role of sleep and dehydration and also low blood sugar. So in this, basically alcohol disrupts sleep pattern. Even if the person sleeps, the quality of sleep is being suffer. The person would suffer, increasing the emotional sensitivity. And when it comes to dehydration and low blood pressure, these are also common hangover effect that can make emotional regulation harder and worsening the anxiety. Now, who is more likely to experience it? So anxiety can happen to anyone who drinks, but it is more common in people who already have anxiety or mood disorders, drink heavily or frequently, use alcohol to cope with social anxiety, and when they don't hydrate themselves or eat while drinking. Now, what are the immediate tips to get rid of anxiety? So, you can actually reduce the likelihood of post drinking anxiety by sticking to Australian guidelines, that is, to reduce the risks from drinking by the recommendation is that like the person should not drink no more than 4 drinks in one day or no more than 10 drinks in one week. So remember to treat your body first. First of all is to hydrate. Okay, so drink water or electrolytes, etc. Then eat nourishing food such as bananas, proteins, uh, light solid food. Okay, then rest and sleep is also very important. If possible, try to have. The next thing is to also ease your nervous system. So for that you would be using deep breathing exercises, uh, mindfulness or meditation, then short walk or gentle movement. All this would also help in prevention of anxiety. Now, coming to the psychological coping strategies or cognitive coping. So, first of all, acknowledge your feelings, don't fight them. Okay, and remember or remind yourself it is just temporary, or talk to a friend about what you're feeling, and that's the best way of coping with the situation. Now, coming to the long term prevention strategies, so these are some of the points that you need to remember before and during drinking. So this would include such as like to eat before you drink. So it's always important that your stomach is not empty while drinking. Then to stay hydrated throughout the night. So have spacers, drink something non-alcoholic between drinks and drink lots of water. Then it is important to also set limits to what and how much you would drink. So use small glasses while drinking, so that would actually help you to set limit about how much alcohol you would be consuming. Then take breaks between drinks. Okay, so these are some of the important points to remember. Also, it's important to have a mindful drinking, such as like drinking slowly, sip, not gulp. Okay, then slow drinking at your own pace and not trying to keep up with others. So it's not a competition here. Then try to alternate with water and now also avoid binge drinking pattern. Now, when to seek help? Well, anxiety is that, you know, when it happens frequently and it interferes with your daily activities, then when it leads to alcohol dependence. So, this might be a sign that you need to consult a professional, and health hotlines and therapy can also help with both anxiety and alcohol use concerned. Now, what are the takeaway key points that you need to remember? Well, anxiety is real and it's a mix of physical hangover plus psychological anxiety, and it can happen because of how alcohol affects the brain chemicals and the body. So, you can manage the symptoms with proper hydration, self care, and also mindful habit. So, the final thoughts that you should remember is that it is okay to talk about it and not weird to have these feelings, and you can take a step to prevent it next time. Reference from Everyday Healthline, Alcohol and Drug Foundation. Thank you for watching this video.